Hi, this is Gaylene Hansen, a nurse living and working in New Zealand, coming to you with emotional freedom technique, EFT tapping. It's a simple tool that you can use to address what you may be feeling and give you some relief. In this video, we'll be tapping on the theme of personal protective gear. We'll be using the points on the body, and I'll show you these as we go through them, rather than on our face, in line with our current recommendations. Please remember when listening to each of these videos that you are responsible for yourself. If you need more support, please reach out to me or to someone who will support you. If you do not want to use words, you can tune in with your feeling, or if that's too much, you can just tap through your points and you can breathe. And feel how your body responds. When we're in fear and overwhelm, tapping can help us to move to a place where we can think more clearly again, where we can feel calmer and settle ourselves, which is great for us and it's great for those that we care for. So tap with me, the side of your hand. Even though I am here looking after others who are ill with this coronavirus, or others that are just in my care, whether I'm in intensive care or whether I'm in ED or whether I'm in a rest home. I am here. I am looking after people who are unwell, or I will be at some point. I am wearing my protective gear. And we're going to start with presuming that you do have enough protective gear, and we'll come down to if you don't a little further on. Even though I can feel really hot and sweaty when I'm enclosed in this protective gear, my mask, my gown, my goggles or my full face mask, my gloves, whatever you are wearing, maybe you can feel grateful for this protection and accept what you feel right here, right now. If you're feeling this hot and sweaty, and if you are in protective gear, just avoid this head point. Just move down to this next one. Even though I feel hot, it's really sweaty in this gear. I can be in it for quite a long time. It's hot. It's hard to breathe sometimes. But I can remind myself that I can breathe. I can pause, even just for a moment. Even when I'm caring for someone who's sick, I can pause and I can balance and settle myself. To take a moment for myself. To breathe. To settle myself. To feel calmer. And I can tap for the hot and the restricting feelings. And maybe I can change how I'm feeling. Just take a breath. And for some who get headaches, even though, excuse me, even though I have this headache from wearing this protective gear, my mouth is dry. It restricts what I need to do, what I am doing. I'm grateful that I have it, and I can do the work that I am trained to do. I can stop. I can choose. I can choose to breathe. I can choose to calm myself and give the care that I want to give, that I know how to give. Even though I've got this headache and wearing the protective gear, maybe your mouth is dry. Maybe you feel hot. Maybe it feels restricted. I can breathe. I can pause just for a moment. And when I do, I calm myself. I can tap. And I can breathe. I can settle myself. And then I can be there for those I am looking after. Just breathe and feel. Take a breath. Even though I hope I continue to have enough of this protective gear, and I worry that there's not enough. For some, it may be that you don't have it now, that you don't have enough to protect yourself, that you may have to wear a mask for your full shift. It's one of the things I'm hearing. Maybe I can choose to feel safer. Maybe I can choose to settle myself. Maybe I can tap through all these feelings if I don't have the gear I need. I can calm myself. Maybe I can calm myself. Maybe I can breathe. I'm breathing now. Right here, right now. I am breathing. I am settling myself. I am calming my immune system, my nervous system. And I can be the best I can in this moment. So I take a few moments to tap and breathe and notice where I feel it in my body. And then I can move forward as I let some of these feelings go. And I can help my colleagues to acknowledge their feelings, their concerns, their experiences. And together we can shift some of this energy. I can connect in love. I can connect in passion, compassion for others, for those I care for. And we can change the energy around us. And that would be good for us. And it would be good for those we care for. So right here, right now, I tap and I settle myself. And I acknowledge my feelings and emotions. And I let them go. My body likes this. I like this. This I can do. Place your hands over your heart. And just take in some slow breaths as deep as you want to. If you would like to learn more, you can find me on www.nurturingnaturally.nz. With love to you, Gaylene.